Okay, so our first class of drugs is going to be the gold compounds. There's only one medication in this group, which is the Aranaphen, seen here by the gold nugget with the AU in the middle symbolizing gold. The macrophages eat the gold salts, seen here by our little macrophages. This stops the lysosomal enzymes from being produced. So our Aranaphen saves the tissues, shown by the tissue box here. This medication should not be used while a woman is pregnant or breastfeeding, seen here by the baby. And a nursing intervention, we should recommend the use of contraceptives, seen here by the condom. We need to monitor for gold toxicity, shown by our toxic waste. We also need to monitor for acute renal failure. And we need to make sure that we're monitoring our platelet count, shown by the counting plates. Platelet count should be done every month, as well as a urinalysis to monitor for blood or protein in the urine. The most common side effect of this medication is diarrhea, so we need to educate the patient on that. We should also be educating the patient to watch out for any blood in the stool, shown here by the eyes watching the blood drop. Next, we have our TNF blockers, shown here by our beaver who builds dams, blocking the water. They work by lowering the TNF levels, shown by the evil TNF man in the down-moving elevator. They slow the destruction of joints by slowing the inflammation response, shown by our slow snail. They are given sub-Q, shown by our syringe, educate patients on injections, rotating injection sites, and how to properly dispose of needles. They increase your chance of cancer and infection, shown by our cancer can. Common side effects are drowsiness and headache, shown by the bed and the crying man, so make sure to educate patients. Routine monitoring of labs such as white blood cells and platelets, monitoring for infection, shown by our calendar. Make sure to not give live vaccines to patients, shown by our vaccine jar. And most importantly, before administering to patients, screen patient for TB, hepatitis, sepsis, infection, and cancer. TNF blockers slow the inflammatory process, so these can be deadly for patients. Okay, next up we have glucocorticoids, shown here by our bottle of glue. They are indicated for short-term treatment of inflammation disorders. They impair the ability of the macrophages to leave the bloodstream, preventing them from entering the injured tissues, shown by our macrophages in chains. They block the production of antibodies such as IgG, preventing the immune complexes that